It was about 5 years ago when I had one major crack in my head, and it was downhill from there as far as over the months it became more painful. Couldn't sleep at night, couldn't eat, had constant discomfort in my jaw. Went to my primary care doctor, and he said did an MRI, and his words were that you needed jaw replacement or think titanium to rebuild my jaw. Then I went to a chiropractor who referred me to Dr. Logan, and at that point we were in treatment for several months with an orthotic, trying to get some space to get my jaw so it wasn't so painful. And over that course of time, the pain alleviated. It was at least I could sleep at night. And then we went to the next course of treatment was the reconstruction. Mm-hmm. That was 5 years ago, and since that time I'm basically symptom-free. Have occasional little cracking noises, occasional neck pain, but for the most part, it's gone. It's when I think what could have been with a jaw replacement or the joint replacement, I'm very thankful that I took this course, non-surgical course.
So your ability to chew is improved?
Yes.
Okay.
Mm-hmm.
And when you first came in, one of your major complaints was the headaches, the back of the neck, base of the skull. You said it felt like a major compression of your
mm-hmm.
back of your skull.
Got worse over the summer. I would say maybe 3 months where if I slept 1 or 2 hours a night, that was a lot. Mm-hmm. It was up, and I think that's when we did the MRI, trying to find out what was going on. And then it did everything really, has been very normal for me. And I don't really notice that I have TMJ, or, I'm careful, I don't bite into things that I shouldn't bite into. But for the most part, I can eat just about anything. I don't really have any pain. So I'm very thankful for that. It was a rough few months up until we started treatment. Mm-hmm. So I'm thankful for that.
And I remember at what time you were wearing the splint for about 3-4 weeks or so, and we had relieved 85-90% of your symptoms, mm-hmm. and then we took the splint away from you for a day.
Mm-hmm. Yes.
And what happened?
Everything came right back.
Came right back. You got your back in the splint, and then mm-hmm. then you were able to make the connection between what was happening.
Mm-hmm. Looking at people's case histories, it's very scary because a lot of people go the radical route and end up worse off than when they started. So.
You mean the surgical route?
Yeah. Mm-hmm. Mm-hmm. And it seems a little more extreme for me. So it was something that I didn't choose to do. So it was either find a way to alleviate this pain, mm-hmm. or that it was going to be with me forever.
The headaches are gone. Neck pain is gone. The jaw pain is gone. Mm-hmm. Pain with chewing is gone.
Yeah, I don't think about it all day. It just doesn't occur to me.
Excellent.
So, thank you.
And we got a beautiful smile.
Oh, that too. In fact, just yesterday somebody asked me about, your smile is beautiful. I get it all the time. I volunteer at Mayo Clinic, and a lot of people will say something to me there. It's amazing. That's wonderful. All was part of it. So everything came together.
That part was a bonus.
Yeah, exactly.